Sure.
Okay. Hi. Thank you for joining us today. I'm Dvora Entin. I'm joining you on behalf of Yesh, Tikva, which is an organization that supports Jewish couples facing infertility. And we are joined today by a very special friend, mentor, peer, colleague, etc., all-around great guy who likes to scuba dive, named Dr. Daniel Singley. He is joining me from the West Coast, super chilled out, hanging out in his office. And I'm on the East Coast 3 hours ahead. So I'm glad that we got to finally coordinate our schedules and spend some time together. So the reason I wanted to reach out to you is I know how passionate you are about fathers and fatherhood and the issues that relate to the couple when we are dealing with anything related to maternal mental health. And for the purpose of this conversation, specifically, we're going to talk about infertility and looking at what are the factors that we want to be mindful of as a community, as helping other people who are going through infertility, but recognizing that the audience are those that are probably in struggle or have been in struggle. And just, one of the things that comes up for me when I work with women is so how often women will say to me, I just don't feel like my husband understands how hard this is for me, and he just doesn't get it. And then the husband will say, well, I just don't know how to support her properly, and tell me what I can do better. Because as you know, it tends to be the female identified patient. And we tend to see the husband as like just the partner, unless it's male factor infertility. But even then, it tends to be female centric. So I wanted us to just start the conversation. Before we begin, Danny, could you give us a little intro about who you are and how did you come to do the work that you're doing, and what's your professional sphere?
Sure. Yeah. So thanks very much for having me on. I've been really looking forward to having the opportunity. So I'm a psychologist, and my specialty broadly is in men's issues. And so I have a private practice in which I see almost exclusively men. I see couples as well, and that tends to be when I'll be working with women. I also teach classes for expectant dads, and I have a research program that focuses on the psychosocial transition to fatherhood. So the dude to dad perinatal period, basically. And I do a good amount of training and organizational consultation with organizations, agencies that want to better involve dads around the antenatal birth and postpartum period. And in those capacities, I've had the most experience with infertility issues in my private practice and working with the dads and couples who are either in it, as you said earlier, that are struggling with the infertility or going through IVF, IUI, or oftentimes then once they're able to conceive, commonly I'll see them on the other end as well because of issues that they're dealing with as a result of having multiples and the multiples community and some of what goes along with that.
Great. So, one of the things that I was, thinking about is how often it is that we don't, we stereotype the men. We stereotype, the men are all like this and husbands are all like that. I was wondering if maybe we could kind of tease that out a little bit. What I hear from the women, for the women that I work with, tends to be a deep feeling, or it can trend toward a deep feeling of isolation. So sometimes we've got these partners that are really working collaboratively. He is successfully supporting her, and she feels connected and supported by him in this process, especially if she is naturally the identified patient. But I'm seeing more often the women that are coming into treatment or to care will say to me, like, I just feel very alone. I feel very isolated, and he just doesn't get how hard this is for me, and I just don't feel supported. And, I wanted to know if we could start teasing out a little bit from your perspective of the husband's role. And obviously for the purpose of this conversation, we're talking about a male-female partnership just for the purpose of this conversation. What are some of the things that you want us to know about the husband in the role when the wife is the one that's going through infertility and they're both struggling to have children, but she tends to be the one that's absorbing the brunt of the medical care? What are some of the things you want us to know about the men's perspective?
It is. So it's a really, really important distinction that you're making, and sort of like the top level way that I can answer that question is by looking at, okay, commonly it's Is the man the source of the infertility? Is his partner, is she the source of the infertility, or is it unexplained infertility? And there's a lot of overlap in terms of what you'll see, but there's a lot to be said for the whole guys just go into fix-it mode. And as is often the case with sort of major life milestones, particular ones that have medical implications, like somebody has a stroke, someone is suffering, there's a tendency on everyone, generally independently of gender, to go into sort of operational mode. What's the next test? What's the next procedure? What are we doing? You know, and to focus on the logistics of it. And that's, I think, ramped up in a scenario where you have the female identified patient. If it is sort of, okay, they've been able to determine it's something on her end as opposed to on his end, oftentimes I will hear from the guys a real feeling of powerlessness and a sense that I need to be doing something. And oftentimes this is when, you know, so the therapist thinks, oh, you just need to talk about it. However, oftentimes being able to clarify to the guy that stopping and putting the agenda aside and the just focusing on the test or how can I do and fix go, just wait and put that aside and learn to ask open questions that are designed to get at what's this like for you. But then even more challenging is for the guy to have reflected and to then be able to follow up with, and here's what's going on with me. Not just, here's what I think we need to do about it. And the first part's hard enough, getting him to stop doing the fix it or frankly the minimizing. Oh, you know, buck up, camper, it's fine, we're going to get through it. A lot of times that's driven by the distress that he's feeling himself. Like, it would be a lot easier for me if you weren't so distressed. So I'm trying to minimize or bring it down, oftentimes as a misguided way of dealing with my own distress about your own situation. So that's one big one.
Yeah, I love how you tease apart that in several different ways, but that idea of one is like, let me just do something. And then the other piece of even acknowledging my own distress, first of all, in seeing you uncomfortable, and also the uncomfortableness of this for me as well. What are some of, I always like to be able to offer people something on the practical side that if I hear this conversation, I might say, oh, I never really thought about that way of communicating with my spouse as she's going through treatment. I want to touch on the male factor infertility actually as a separate category, because I think it holds totally different implications. Mm-hmm. What are some of other than the taking a pause and like learning how to ask those open-ended questions, which I think is so valuable, any of those practical steps that you've come up with that can assist somebody when the wife is going through treatment and the husband doesn't know how to be physically, practically supporting her in that way? Any things that come to mind?
Well, yeah, I cannot overemphasize the importance of the assertive communication, trying to communicate proactively when there's conflict, making sure that you're fighting fairly and leading with wanting to understand and all that. For any couple that I'm working with that's at dealing with reproductive issues broadly, but certainly around what can be the real meat grinder of the infertility process, is I tell them you have to do a weekly State of the Union meeting. Yeah. Just like, you've got to do it. And the State of the Union meeting, like I like to be practical and hands-on without being overly, regimented. But at the end of the day, when you're spending the time, the money, the emotional energy, frankly, and there's the emotional intimacy and then the physical intimacy implications, which are a really big deal in this. Being able to have to count on a once a week, we're going to check in. And the way that I have folks do it, it's very scripted, and it's sort of in a John and Julie Gottman kind of a format, doing this State of the Union check-in where I'll tell them, look, you need to take 10 minutes once a week, and in that 10 minutes, You got to tell each other in this order, what do I think is going well in our relationship? What's something I'm struggling with in our relationship? And then what's something that you, my partner, what's something you've done that helped me to feel loved, cared for, and connected? I'm going to tell you those three things, and you're going to tell me those three things. And what we're not going to do is fix, minimize, try to change the topic. In fact, the only thing that I can do is back to that assertive listening with wanting to understand and not wanting to understand, what do you want to do about that? In fact, the thing that I've added onto that is, you got to do this. Sure, it's uncomfortable, but all the research says it's a lot cheaper than couples therapy.
Right.
And it works. I mean, what couple engages in regular, proactive, balanced communication about their relationship, not in the wake of some capital E event?
Right.
So, and you got to wait 6 hours. You can circle back and talk about, well, okay, now what are we going to do about it? But you have to just understand and listen and process, then come back to it. That's one thing.
I love that idea also because it addresses one of the other factors that I see where women will say, I don't think he understands, or he's not feeling this the way that I feel it. And what I think that what that also offers as an opportunity is that we get to then hear the spouse be able to say to his wife, I'm also sad. I'm also distressed. I feel terrible that you have to go through this. Or I'm also longing for a baby. I'm also feeling that sadness that we don't have a child. And sometimes the women tend to own so much of that emotion because the husband isn't expressive in that way. You know?
Well, and oftentimes my experience has been that some men are, but a lot of times, so I'm speaking very broad brushstrokes here, of course,
Sure.
but a lot of times guys just don't have the vocabulary to say things like, I feel like my transition to father keeps getting interrupted, or I feel like, we just made it through the first trimester, we're in the clear, and then they're not.
Right.
And then they have a miscarriage, or there's some sort of event, and then they cycle back. And a lot of times guys just don't have the vocabulary to talk about that kind of loss. In some cases, they don't feel it. In some cases, they're just more like, I don't know, this is more of a her thing, and I'll believe it when it's out. And there is that. And so there's a certain level of protective factor to that. But that sort of that sort of role transition interruption, that's just this sort of hanging sword of Damocles, that can be really stressful, but hard to talk about, hard to even identify.
Right. Oh, I can hear that completely. And in terms of, let's say, the male factor in fertility, when we're dealing, it was interesting. I once had a woman talking about, her experience of intimacy with her spouse, knowing that there was male factor in fertility, and how did she, and we talked so she talked so magnificently about the idea of that she sees her experience of intimacy with him exclusively about pleasure. And it was it was different, where typically, especially in many very young couples, when they're very focused on having children in our community, really intimacy tends to take on the primary role of having children. And so when that was removed from the equation, instead of feeling devastated by that, or perhaps undercutting his masculinity or his identity as a man, she was able to say, well, that's off the table, so this is purely about fun, which I thought was an extraordinarily healthy perspective. But talk to me a little bit about what it's like from your perspective, from the male's perspective, even if it's just stereotyping or just in the generalization way of it, when a man knows that it's primarily male factor in fertility, and how does that tie into this identity?
Well, the top level assumption would be that it's that stereotypical, like, hey, my swimmers aren't working, and so that's emasculating. And I certainly have seen some of that. I think in order to really get your arms around it, it's a bit more nuanced than that, in the sense that if he knows what the cause was. So, for example, if there's somehow this runs in the family, and there's a family history, and they can get beyond the shame to actually talk about that, or if some sort of occupational thing, like exposure to different sorts of toxins that may have played in. But it's also, I think, considerably more difficult to just sit with, like, I don't know. I never knew this was a thing. It hadn't occurred to me that I would be the holdup here. And frankly, a lot of this has to do then with his willingness to actually to deal with it. Like I've seen everything from plain denial, like, well, if it's me, then I'm not willing to do anything except we'll just keep trying, which is ridiculous because when the shoe's on the other foot, the things that we do to and for women in that position can be pretty extreme. But honestly, to me, like as the therapist working, it's the guys that are coming from that's just sort of stereotypical, like, oh, the shame of it not being me, or like the denial or the sort of alexithymic, like I'm staying away from those feelings and those feelings don't exist sort of thing. That's honestly the easiest thing to deal with clinically. For me, it's considerably, it's more meaningful and more difficult when he doesn't really know what it is and has a reaction that tends to shift and is a bit more along the lines of, wow, this reflects a kind of existential thing for me. Which is nice in the sense that he's more in touch with it, but it's also really upsetting. And it's at that point when sort of the shoe's on the other foot, when we talk about he doesn't know how to support her and she doesn't feel heard, oftentimes we don't really think about what does it look like when you're trying to support a man or the dad. And the reality is there isn't a one size, in the same way there's not a one size fits all approach to supporting women experiencing infertility or new moms or pregnant women. It's the same thing with the parallel being men. And a lot of it has to do with how does he understand his own role? What are his hopes? Does he experience something? Like one thing I can say is that there's this concept of father hunger. And actually the initial look at this was for women with eating disorders who have issues with their fathers. That's not what I'm talking about. What I'm talking about is men who, if you ask them, what did your own father do that you really want to emulate when you're a father? Either nothing, or I'm going to do exactly the opposite of what he did. And if you get that answer, that's a very high likelihood that he's dealing with some issues around, am I just damaged goods? My model was so off. What do I have to offer? In some cases, it's not that. But some of the hardest cases that I've worked with are folks that come from a situation like that, and they're experiencing infertility as a result of him.
Interesting.
Sometimes it's like well, maybe the universe just doesn't want me to. Sometimes there are religious reasons involved, or more sort of spiritually oriented, or just like, screw it. Rather not face that kind of thing.
Right. Wow. Powerful feelings. Very, very powerful. You bring up the idea of this parallel support because we talk about the man supporting the woman, but what, I think about also how critical it is for us to remember the spouse in this process as well. And some of the ways that men appreciate, what are some of the supportive ways that we can create just beyond communication? Because sometimes the communication part is scary for the husbands, especially. The women are like, let's talk about it. And the men are like, can we not talk about this all the time? But at the same time, not, underestimating the spouse's need, the husband's need for support as well. And to be acknowledging his process in this as well. And I was thinking, what are some of your thoughts about how a woman might be mindful of the needs of her husband as they together go through this process, whether it's male factor or female factor? There is a couple here that's trying to have a baby.
Well, generally speaking, I'm a huge advocate of having what I think of as a diversified social support portfolio.
Yeah.
What that boils down to in practical terms for a lot of these dads is working on the relationship hygiene with the mother, with their partner or wife or spouse. That's critical. Like that's just front and center. If you're not paying attention to that, then to me, you're missing a really important factor that goes every bit along with medically what they're doing. But beyond that, and this goes equally for the moms as well as for the dads, to me, the magic number is 4. In addition to family and their romantic partner, they got to have 4 other sources of support or connection. And that doesn't mean I got 4 best friends that I'm out spilling my guts to and having these big emotional moments, what it means is that they've got four. Both partners have this. But oftentimes it's the dad that is trying as hard as he can to get all of his support needs met by just his partner. And it's unsustainable no matter how great she is. And so the way I'll work with dads on that is to say, okay, who are your columns? You know, I'm big on worksheets, so of course I have a worksheet on this, but I'm like, okay, who are your columns? And sometimes they have all these excuses for why or why not or this or that. But what I'm really pushing is you got to make sure you and I, we've identified four people who you're taking small, slow, steady steps to connect with a bit more fully. And oftentimes with men, what that looks like is commonly men are socialized to be more indirect. Like I think of it in sort of a triangular, like, you know, men, I'm pointing to you as if you're a man, but we're socialized not to sit down and start saying, hey, I'm Danny. Here's what I'm about. Here's what's important to me. Here are my hopes, my dreams, my fears, and so forth. Like we're much more socialized where I'm going to talk to another guy about that thing, my work, the weather, that service we went to, whatever it is. But you and I, we're talking about that. And then over time, closeness in our relationship, when we look at closeness via communication is if the leg on the triangle becomes shorter and shorter. In other words, it's less indirect. What I'm looking for in men that are experiencing infertility is they've got somebody they can go have a coffee with, they can go for a walk with, go play golf with, or just, you know, they can send texting cat videos to each other and they can do some of this. But then also sometimes when it's really hitting the fan, they can do some of this.
Wow.
Like that to me is essential.
Yeah. That I think that's so wise, like you say, on both sides of the relationship, that not having all of your emotional needs met by your spouse and making sure that there's especially for the women, especially when they have a social community that they can invest some time with, they don't feel as abandoned or neglected, or they're a little less itchy, they're a little less irritable about the relationship that they currently have, and are a little bit more open to being to working on that marriage rather than feeling like all of their needs are not being met. So they have some needs that are met outside the marriage in terms of friendship. I think that, you know, one of the challenges to that I see so frequently is how infertility is so isolating. Like they tend to pull back from community because the pregnancies and the birth announcements and the social medias and going to synagogue and seeing, you know, all the carriages in the front entranceway is so triggering. And it just feels like I'm not part of that community anymore in the same way that I thought I would be, or the way that I was imagined that I would be, or the way that I always felt comfortable, but now I don't feel so comfortable anymore. But looking at that as like, so where else do I find my people, or how do I be a little bit more selective and making it might be a smaller community, but a community of people who I can be comfortable with, that I can create connection with, and ultimately be filled up in some way to better manage my struggle, my experience.
And the community building piece is so difficult because there tends to be so much shame that goes along with infertility. And one of the dynamics that I've seen at play is that men are looking for community, but not around that.
Right.
Or that in the cases where they have like a good buddy that they are talking to, and they're not just doing the like stereotypical like shut down, not talking about it. But one of the sort of traps that I can see them getting into, both with other folks that are experiencing infertility difficulties and ones that aren't, is that conversation can just turn into battle weary. Here's the last test. Here's the most recent procedure. It can sort of turn into kind of like a lecture on, let me clarify to you what you need to know about my situation, even if you're not in my situation, or even if it is somebody else with another dad. I mean, think about the opportunities to connect dads currently experiencing infertility issues. Like it's the rare clinic or provider that's going to work to, under their roof, bring folks together. I've seen it happen. I've really been able to help to do a little bit of that here in San Diego, but that shame piece is really powerful.
Yeah, I will say, and with this, I think we'll wrap up in a bit, but in a minute or so. But one of the things that I think is so magnificent about these kinds of the Jewish organizations that do exist more so on the East Coast than on the West Coast. Yesh Tikva represents on both coasts, but there's several other organizations that also do these social experiences for couples dealing with infertility. So they have the primary infertility group, the secondary infertility group.
That's great.
But it's around fun things, like it's taking a boat ride, it's having an entertainer, where the focus is not on infertility, but they know that when they walk into that room, that they're among people who get it, and that there isn't that pressure to have the conversation around treatment. But I think seeking out opportunities where we can find that community, I think, is so valuable. At the same time, I'm thinking also how critical it is to create the foundation of the relationship first. And that whether or not you're going through treatment, the marriage, the relationship, the partnership has to be the primary, it's the foundation, it's the bedrock.
Yeah, exactly.
So you have to continue, even though we're going through treatment, you got to keep dating your spouse. Even though you keep going through treatment, you got to find time to spend together. Even though you're battle weary, finding things to talk about other than fertility treatment is so critical.
Well, yes. And so, yeah, we can wrap this. I would be remiss if I didn't bring this up as a men's issue. We used to have sex because we liked it. Now we have sex on command, and I feel like I feel like I'm a conduit more than anything. Like it's kind of a cliche, but it is very real in terms of folks that present to my office and the dads that are talking about, like, when they're in that specific phase of type of infertility difficulty, the reactions to it vary. Like sometimes the guy has sort of a sense of humor about it. It's like, hey, it's me or the turkey baster, and I'd rather it's me, or something.
Right.
Folks, it's like, it's not. It's very much I don't feel like she values me, and it really is a hit to both the physical and the emotional intimacy.
Right, especially if the physical intimacy was something that was really treasured in the relationship and enjoyed, and a nice way to come together, something that was pleasurable for both of them. That then removing that, in addition to all the other stressors, can really be really difficult. Can be extraordinarily difficult. I think at another time, I have plans to interview a sex therapist specifically on those issues, to talk about how do we create an intimate relationship independent of infertility. Like, how do we maintain that relationship, that connection, where intimacy can be still something that's celebrated and enjoyed independent of fertility. But I agree with you that it's something it can have an incredible impact on a marriage. Absolutely. Any last thoughts, comments, things that you wanted to bring up from the guys' perspective as they journey into fatherhood?
Just generally speaking, the advice to the guys is, don't just shut down and let it roll off your back, and it is what it is, and deal with it in silence. Because even if that gives you a short-term benefit of, you don't have to face the shame, and you get to be in the moment of doing it, it's problematic long-term for you and for your partner.
Yeah, definitely. I wholeheartedly agree. Thank you so much for spending the time with me today. I'm going to shut off the recording. Thank you to all of you who have joined us and who will hopefully learn and have opportunity to grow from this interview, connection, conversation. Have a wonderful evening.